Good afternoon, and today we have a pleasure of interviewing Dr. Irina Volynsky. She is psychologist and a clinical director of the center. We're taking care about a lot of psychological problems of our time. And in my book, Breathless, I raised that question about psychological testing, if it's advantage or it can bring harm. And we're going to talk about that conundrum today. Because very often schools suggest that neuropsychological evaluation for the child, and for a lot of parents, and feel like no, because they didn't have that type of testing when they were kids, or for a lot of parents, actually that psychological testing, they start recognizing their own issues like ADHD or anxiety through the child struggles. So we're going to talk about advantages of psychological testing. And also we explore learning disabilities, giftedness, attention challenges, and sleep distraction in the patterns, because in my book, Breathless, I talk about really close symptomatic of sleep problems with ADHD, and how accurate diagnosis can bring clarity and targeted support instead of label or stigma. So good afternoon, Irina.
Good afternoon. Hello.
And I want to say some words about Irina expertise. She's just like me, was trained in two countries. She was trained in Ukraine and then in United States. She has a PhD in clinical psychology. But besides clinical practice, she also adjunct professor of City University of New York. And she actually prepare specialists, thousands of specialists, young psychologists who conduct that psychological testing. So we find out what it is. She's a professor and she has 2 decades of experience. So my first question to you, just like my heroine Olga in Breathless, who was facing that choice, school recommend her to evaluate her daughter. And she really was. She didn't like that because she feel that can actually stop the successful, ambitious way she pictured for her daughter in her head. Like any immigrant parent want to bring the child to Ivy League University. Otherwise, why did they come to United States? It's a joke, but it's a very common cliche in the immigrant circles. So I want to ask you about those tests. Are they actually helping? Or what exactly they do, those testing, and who should do the test?
I feel like the second part of your question. First of all, thank you so much for a very kind, over-the-top introduction. Probably not 1,000, but maybe a couple of hundreds of PhD students that I've helped prepare for the life of being a clinician and a tester. But it is a big impact, and I take my role very seriously, both as a teacher of testing as also as a clinician. Now, the second part of your question was who can be helped by neuropsychological testing. So let me answer this before I go into the details of what it is actually. When you deal with a situation where the child has certain difficulties, certain particularities that just don't sit well with you as a parent or with the teachers, where it's, okay, the child is quite smart, but when the child reads, as if nothing gets in, or the child gets along with her or his peers so well, but then when it's time to do a test, it's like a different child. The child is completely frozen, and the child's results on the test is nothing compared to when we simply talk to the child and we understand that she or he knows a lot, but the results on the test are horrendous. What's going on? Or the child writes poems and the level of reading is amazing, but then when it comes to the simplest multiplication problem on math, it's as if that smart child disappears and someone who is just really, again, frozen in spot, comes into the room. So you see the phenomenon of a shut down learner in certain specific area, or there is a discrepancy between how the school sees the child and the parent sees the child. There are gaps in functioning that cannot be explained by just, oh, okay, maybe the child doesn't get along with a particular teacher. It's year after year. Then this is when the testing is very much needed. Testing is right now a gold standard for diagnostics. We don't have anything else that would be better, more precise, more detailed compared to a neuropsychological testing. So when in doubt, in terms of some gaps or discrepancies in functioning, testing is a really good idea. What testing is? What is neuropsychological testing? We admit, first of all, we meet with the parents and we conduct a very detailed developmental interview about all the child's milestones, about the family dynamics, about the expectations at home, what the child is exposed to in terms of enrichment, to understand, given all of that, where the child should be. When the child is young, 6, 7, 8, we sometimes conduct the in vivo observation. In vivo meaning in real life. Because when you bring the young child, into the office of a doctor, they will act slightly different. So when we have questions about certain social components of the child behavior, we do a school observation to see how the child is at school in a normal, habitual for them environment. And then we do IQ testing, cognitive testing, right? We are less curious about the specific number, that's his full scale IQ. We're less concerned with that. We're more concerned with the level of ability, of innate ability that the child exhibits. Because then we compare it to academics, then we look into attention, concentration, memory, learning, and then, last but not least, we look into social and emotional development. The sense of self, the level of self-esteem, the level of understanding of others that the child demonstrates. So when we compare all 4 areas of functioning, cognitive, academic, pure neuropsychological, attention, concentration, memory, learning, all that, and social emotional development, we get an incredibly detailed, comprehensive picture of where the child is at the moment. And way more frequently than not, we're able to answer pretty much all of the referral questions. What's going on, why there are discrepancies, and more importantly, what can be helpful. Because at the end of our clinical report, there are a few pages, not 1 or 2, a few pages of detailed accommodation and recommendations of what the child needs to succeed, to be fulfilled, and to be a happy and contributing individual down the line.
Like, I'm going to express my view, and maybe some of my listeners really surprised why I brought the testing or psychologist on my channel. No, number one, I'm sure everybody knows I'm a parent. I have 2 boys and I'm an immigrant parent. So I have my own view on a topic. But from another standpoint, I'm a clinician. And I have to admit, 50% of my young generation patients actually on Ritalin. And as a dentist, you might say, oh, why dentists should care about Ritalin? But I'm going to explain to you what Ritalin make muscles contract. And those Ritalin patients have usually a really severe flare of temporomandibular joint pain. Some of them, might take a medication, not pay attention. Some of them pay more attention to that. But Ritalin have that wonderful side effects, which is not so known or not what people really pay attention, because, oh my God, I'm not going to succeed on the test. I'm going to take a Ritalin. Who cares about those teeth when it's my life on a line? My view on it different. And, maybe it's a very narrow lens, but the topic is really, close to my heart for those 2 reasons. And I'm going to ask you that next question. You work with children across cultures and systems. And how does damaging of child's future prevent families from getting that clarity, but in the same time, we're talking about immigrant parents who never have that, that kind of lens. I want to bring, the ideas, or at least Soviet parents, you keep grinding and grinding and you get to the point, and you might not fit to the regular box because you might be different. That culture of a Jewish family, it was very, very common. You just stay focused and keep going forward. I want your view. It's really a little bit deeper question to the testing, because testing give you, as a person who got tested, not me, but as a patient who got tested, also have that, okay, I got tested, now I can take something what's gonna help me. We're talking about Ritalin or other chemical substance what help me focus. Like this, cross-cultural and modern time question. What's your thoughts?
I have to say, you seem to have a propensity of asking about between 5 to 15 different questions in your
Right.
question. So now I have a choice as to which of them address first and second and fifth, maybe. You mentioned about 50% of your patients being on Ritalin, and I believe those numbers, but I am familiar with the stats, and the statistic is such that it's not like 50% of a child population meets the criteria for ADHD. So quite frequently, other conditions are mistaken for being ADHD, such as, for example, the sleep deprivation, when the child suffers with various different conditions that may lead to sleep deprivation. Many of them are within your ballpark. But one of them that's very much not paid attention to, I believe, still in our society, is screen addiction. Because sometimes children are just, watching the screens throughout the night, and then they are terribly, terribly tired in the morning. And we know that an underslept child's functioning is similar to that same child functioning 2 years prior to that moment. So the child loses about 2 years of cognitive, academic, and neurological advancement when the child is underslept, be it whatever reasons. So sleep has to be explored quite well. And I mentioned before that the golden standard of diagnostics is neuropsychological testing, because, again, quite frequently such conditions as dyslexia, as language disorders are mistaken for ADHD. Why? Because, for example, if you can't really put together what those little signs, little letters sound like, and you can't really read, you're going to be really bored in class because you really can't read the same test. So you're going to be bored. You're going to look inattentive. Or if the language piece is incredibly difficult for you, and the only channel of taking information that's open to you is visual spatial, while lots of information that's taught to you in school is done through the auditory channel, you're going to be bored to death, because it's as if you were studying, I don't know, math in Japanese language without speaking Japanese. That's pretty boring. So the question as to why the child does not pay attention is the best answered through observation and detailed testing. Now, in terms of grinding through, the immigrant mentality. Remember the definition of insanity, right? Doing the same things that you've been doing before and expecting different results. Quite frequently, parents come to me with the recommendation from the teachers of repeating a grade in the same school, in the same environment. Pretty much never, ever, it's a good idea, speaking about grinding. It's just not, because if the child has not been receiving appropriate help the previous year and will not be receiving appropriate help next year, why would that child be helped by sitting in the same class through the same material? Something needs to change. But what exactly needs to change? have to be determined by a team of professionals, including the child's teachers, whoever can observe the child in school, and quite frequently their pediatrician, their dentist like yourself, who may know what is going on in the mouth and what prevents them from being able to sleep and being able to be rested and being able to absorb information, and the psychologist who had done testing and knows where exactly the child is in all of the child's areas of functioning. Last but not least, when it comes to addressing the question of stigma, right? We didn't have testing and look how well we turned out to be. Some of us did, and some of us did not. Did not. Some of us drink, some of us are not doing well in some other areas of functioning. Some of us feel very unhappy, stressed out, have high blood pressure because of the level of stress that we have to live through. So the fact that that we have a pulse doesn't mean that we turned out well. And there is a hereditary component, right? It's quite likely that the child may have some similar to you neurocognitive profile, but it doesn't mean that the child environment the child is growing up in right now is the same as yours. So there's no guarantee that the child gonna at least turn out as well as you did. Okay, for example, take the child who has some type of social anxiety and possibly inattention. That child within the American educational system has to move through from class to class with a different crowd of students and different teachers every year. The expectation of being able to work independently is tremendously bigger compared to the background we're coming from. In fact, in our cultural background, previous one, right, the independence was sort of almost punished. We were supposed to learn what we were given in class, come back the next day and rehearse it. And even people with problematic executive functioning skills, such as in ADHD, even people with some level of social anxiety could more or less do it because it was very predictable. Here, the environment is much less predictable. That's why the methods should be different. And in terms of stigma, I mean, generally speaking, children who get help throughout their schooling years tend to fare substantially better compared to children who did not get help. Obviously, it's such a self-explanatory thing, but I'm a pretty upfront psychologist, so sometimes I say that, look, if you think that your child will get into Harvard because we keep their diagnosis under the rug and the child is not getting any help, that's probably is not happening. Okay, because the child is not functioning at a level that he or she should be functioning. Can do much more. But look where the child is. And while everything is swept under the rug, the child is also getting tremendous blows to their self-esteem.
You know, life is such a complicated story. My last question to you, I know a lot of adults, through that testing found their own ADHD, diagnosis and anxiety, things like that, what they can now name and get help. So what's your view on that? And now, not asking you 10 questions, it's still one question, with the constant uncertainty, the rate of burnout, AI is coming, what am I gonna do? What your view on adult testing and then action after the testing?
Okay, excellent questions. Truly one, surprisingly.
Truly one.
Truly one. So the testing also gives you a very detailed profile of where you are. And when you get your own profile, not only you learn what your weaknesses are and diagnose the categories you belong to, you also learn what your strengths are. And if you're thinking about maybe acquiring a different profession in light of AI taking all the junior positions in your field or something like that, it's incredibly smart to move professionally to the areas that you're good at, you're strong at. Because if you only feel terribly challenged every single day in your profession, I don't think you're going to enjoy it much. And I don't know how much you will achieve if it's only pure challenge, if there is no enjoyment, if there is no sense of, I'm really good at what I do. So testing also allows us to learn as adults, what are we good at? What can we do with ease? What can we do with pleasure? And how we can compensate using our strong sides of personality, of functioning. How can we compensate for our weaker, for our somewhat limited areas of functioning? Let's say if your visual memory is amazing, you go to the opera, maybe it's a good idea to first read the content of what's going to happen, learn more about it through the visual channels, then you come in and you're able then to comprehend what's happening through the auditory channel. Same thing at work. Let's say if you need to remember what happened during the meetings, ask for access to for the minutes. Ask someone or take notes yourself, or ask someone to take notes. Use AI to take notes. Look at the notes. This way, you'll be better prepared for the next meeting. You will suffer less. Your focus is going to be better. So even for adults, even for like middle-aged and up adults, testing has a lot to offer in terms of knowing, learning who you are, what you're good at, and what the path that you are on can have for you that's more fun, more fulfilling, and just plainly more interesting.
That's a totally different lens than I brought in a book. So I like how our conversation lead us to how testing can help kids and adults without being stigmatized.
Yep.
And I'm sure our listeners, so thank you very much for our audience if you have trouble sleeping, because not only because of snoring, but because of erasing thoughts and waking up at 3 a.m. thinking, what am I going to do in this uncertain time? Maybe the testing can be an answer for you. Or if you're a medical professional who trying to lead or guide their patients to the better path, maybe testing can be one of the tools or recommended tools in your armamentarium. So thank you very much, Irina, for such a wonderful and clear answers. And now we have the path.
Thank you. Take care.